The following segment is sponsored by the Dermatology Associates and Surgery Center.
And welcome to today's edition of Ask the Expert. I'm Shea Paul, and I am here in the studio with nurse practitioner Jennifer Whaley from Dermatology Associates and Surgery Center. Jennifer, thanks for being with us again this week.
Sure, thank you.
Last week we started our discussion of skin cancer with a conversation about a precancerous condition called actinic. Am I saying that
Yes,
correct?
actinic.
Keratoses.
Correct.
Okay, so we're going to continue that discussion today by discussing a form of skin cancer that can actually evolve into if left untreated, and that is squamous cell carcinoma, correct?
Yes,
I'm
that's correct.
really getting an education here. So can you tell us a little bit about squamous cell? What does it look like? What is it exactly?
Sure. Squamous cell carcinoma, it's a non-melanoma form of a skin cancer. And these skin cancers usually come from long-term sun exposure. Okay, we see these in patients who are very fair skinned, patients who've spent a lot of time in the sun. Maybe they were a beach bum, maybe they've worked a lot of, hard hours out in the sun.
Right.
And so they have just constant sun exposure, severe sun damage. And those precancers that we've talked about before, those will develop into those squamous cell skin cancers.
If left untreated.
Correct, yes.
Right, okay, all right. So can you tell us a little bit of what they look like?
Sure. So,
And I think we've got some pics coming up as well.
Sure. So if you look at this picture, Shea, you probably remember from when we've spoke before, the actinic keratoses and the squamous cell carcinoma, they look similar. So the squamous cell carcinoma is obviously the more advanced and actually a skin cancer.
Okay.
So you may see a roughened, raised plaque on the skin. Those can often bleed easy, and they may be tender for patients. And they'll just gradually grow. It may be an area that just won't heal up for the patient.
I see, I see. And obviously people probably who don't recognize this will think that they can treat it at home with ointments and what have you, and
Sure.
that's
They think it's dry skin, maybe
Right.
it's eczema, a sore that just won't heal.
right. So point being, anytime you see something that won't heal, that's an indication there's something wrong.
Yes, definitely.
Yeah, okay. So what are the treatments that you perform there for this?
So we recommend excision for those to remove the cancer in its entirety. Now we can do an excision in the office. Dr. Velasquez also does Mohs surgery in office. Other options we have, we might do a referral for radiation or even a topical therapy, all dependent upon the patient.
Sure, because I'm sure every case is
It's individual, sure.
and unique. Okay. So has there, just my own question here, has there ever been an instant where a squamous cell carcinoma has progressed into a more serious form of skin cancer such as melanoma? Is that possible?
No, so
Okay.
they don't overlap.
Okay.
Now, melanoma skin cancers, those are more aggressive, and you definitely could have a melanoma.
Right.
Because you've had excessive sun exposure.
Okay.
But it's not something that's going to turn into melanoma.
I see, all
And
right.
that's a key thing I try to tell patients. A lot of time they hear the word skin cancer and they automatically think it's melanoma, think worst case scenario. And even
Sure.
if it was melanoma, if caught early, it's
Highly treatable,
Yes.
right? And I know there's been a lot of advancement in technology and in the ways that melanoma is treated as well. So, and next week we're going to talk about another form of skin cancer, basal cell carcinoma, which is very common, correct?
Yes,
okay.
that's the most common.
Okay, all right, Jennifer, thanks so much for being with
Thank you,
us.
Shea.